Hello guys, this is Dr. Mohammed Srinivas. Winter has come. So with the onset of the cold temperatures, the respiratory problems commonly occur in everyone. So once the winter comes, once there is sudden drop of temperature, people start sneezing, they can have running nose. So this is very, very common. So these occur because of two causes. One, people are allergic to cold, allergic to the low temperatures. That's okay. So because the temperature is not low continuously, it usually changes every 2-3 days. The temperature again goes up, again falls. It's usually is like this. In those situations, it's not a severe issue. Second issue is with the low temperatures, it brings viruses. So there is a sudden spurt of running nose, fever, cough among the whole population. At this point, meaning the second week of November, 90% of population of Hyderabad is infected with viral fevers. There are continuous fevers. So how do you know if it is a small allergic cold or viral infection is? The usual allergic cold, it just is confined to the nose. It's there for a few days and it's gone. If it is continuing for more than 2 days, and if this running nose and discomfort slowly gets to the throat, and after a few days you feel some heaviness in the chest, some dry cough, then it's not just a simple allergic cold. It is a viral, probably a viral fever. A virus has attacked, and slowly the infection is spreading. Viral infection is spreading from the nose to the throat to the chest, central part of the chest, and sometimes to the lungs also. All this, if it is 2 to 3 days, doesn't just needs a symptomatic treatment, meaning just take something to just dry up your nose and maybe 1 or 2 tablets to decrease body discomfort and fever, and you're fine. But there are situations when this can aggravate and can spread to the lungs, can causing infection to the lungs. Viral infection to the lungs is again not a serious issue, but virus comes and goes in 2-3 days. But when the virus comes and goes, there is a secondary, meaning there are some opportunistic organisms which attack the lungs and can cause a bacterial infection of the lungs, which is called as pneumonia. So pneumonia means bacterial infection of the lungs is called pneumonia. That can be viral or bacterial. This can tilt the balance when the bodily balance of various organs is just being maintained in severe diseases like a severely weak heart, or for example a damaged lung. So we are just maintaining with medicines. So severely damaged heart and very weak and damaged lungs. And third is immune deficiency of any cause, of any infections or any autoimmune like lupus, rheumatoid arthritis, and all these things. So when there is severely depressed immunity, weak heart and weak lungs, in these 3 situations, this can worsen into a pneumonia, bacterial pneumonia of the lungs, and the respiratory function can come down. They may need hospital admission. This happens very commonly. Fourth category is elderly people who are commonly more than 75 years of age. The lung function comes down with age basically. So this is another subcategory of weak lungs, especially with people who have smoked cigarettes and BDs. So yes, elderly age itself can reduce the function of and power of the lungs. So weak lungs also is susceptible to these bacterial infections. Now what to do, how to treat this is, there are some vaccinations which will prevent the virus infection at the point. So when the virus infection is prevented, bacterial infection is prevented. So there are 2 vaccinations. One, to prevent worsening of virus infection. Second, even if the virus infection occurs, you can't totally prevent it. I'll tell you how to prevent it. Second, to prevent a bacterial infection, there are 2 vaccines, one for the virus, one for the bacteria. So this should be taken in people who have the examples I have given: weak heart, weak lungs, and weak immunity, immune deficiency disorders. So these people should take before the onset of winter in September basically, where the rains are coming down, winter is about to come. Then they have to take 2 vaccines, for influenza vaccine and a pneumococcal vaccine. These 2 vaccines please take in in September itself, or even October or November, before something happens. You can take the two vaccines. The influenza vaccine should be taken every year. The pneumonia vaccine can be taken every 5 years. So please take this. Of course, you can give these to anyone, but especially to the categories I said. But if you don't want to have these bacterial infections, pneumonias, anyone can take this. So if you take this, then there is no worsening of lung infections in winter, and you can keep yourself safe and healthy. So two vaccines, again I told you, influenza vaccine and pneumococcal vaccine. Take them as quickly as possible. Give to your parents, give to your in-laws, any elderly people in the family, and keep them safe. Other thing I will tell you, before you give vaccines also, when especially these three categories, when you go out, they should wear a mask so that you don't you are not exposed to these sneezings from others. So usually this is a droplet infection. So wear a mask, take vaccines, and protect yourself. Thank you.